It's not about just fixing one thing, it's rather about understanding the whole picture. Hi everyone, welcome to my channel. If you are new here, welcome. My name is Holly and I am a sex and relationship therapist, and today I want to talk to you about an important topic, and that is why women in committed relationships often struggle to achieve orgasm. It's something that many women experience but is often not talked about openly, so let's break it down. First, it's important to understand that achieving orgasm is a complex interplay of psychological, physiological, and relational factors. Here are some reasons why this might happen even in a secure and loving relationship. Starting with medical factors. Certain medical conditions like hypertension, thyroid issues, or multiple sclerosis can interfere with a woman's ability to orgasm. Additionally, medications like antidepressants or even some contraceptives can play a role in women having difficulty to achieve orgasm. If you are using one of these medications or you experience one of these physiological concerns, it might be a good idea to talk to your health care provider and see if any of these might be impacting your sexual functioning and what options you might have to address these issues. Another reason why some women struggle with orgasm, even in a committed, loving relationship, is performance pressure. When a partner is overly focusing on wanting you to orgasm, it can create unintentional pressure. This pressure can lead to distracting thoughts and anxiety that takes away from the moment. So if you notice yourself experiencing this kind of pressure from a partner who really just wants to see you feel good, it might be a good idea to talk to them about how they might be unintentionally causing some extra pressure for you, or even seek out a couples and sex therapist to hold space for you two to have this conversation together. Something else to consider are psychological factors. Things like anxiety, depression, poor body image, and poor self-esteem can all impact a woman's ability to fully relax and experience pleasure. Past trauma can also play a significant role here, even in the safest and most consensual of relationships. If you notice that you are experiencing mental health concerns, it might be worth it to check in with a mental health provider or a sex therapist or trauma therapist to help you address how these mental health concerns may also be impacting your sexual health. A huge factor in any person's ability to orgasm with a partner are the relationship dynamics. Even in committed partnerships, unresolved conflicts, a lack of emotional connection, or lingering resentment can hinder intimacy and sexual connection. So if you notice that it's harder for you to achieve orgasm when you're still thinking about the fight that you had the day before or the week before, or you have some harboring resentment from previous ruptures in your relationship, it might be really helpful to consult with a couples therapist to help you address the relational concerns that are now leading into the bedroom. As somebody who specializes in sex therapy and relationships, I often say that sex starts way before you enter the bedroom. So it's important to address whatever conflicts or concerns that you're having outside of the bedroom, so that way you can better address what is showing up in the bedroom. Something else I like to look at when folks are struggling with orgasm is social factors, and specifically society's focus on penetration. Society often deems real sex as being penetration or vaginal penetration. But reality is, for many women, other forms of stimulation like clitoral, oral, or even manual stimulation are far more effective for achieving orgasm. Expanding our view of what fulfilling intimacy looks like can lead to more satisfying and diverse sexual experiences for everyone involved. A tip that I have is to shift the focus from goal-oriented or orgasm-focused mindset to enjoying more of the journey of intimacy. Try exploring different erogenous zones together, like the inner thighs, the neck, or the breasts, or incorporating activities like a sensual massage or mutual exploration to build arousal. In addition, it's always important to keep communicating. Talk openly with your partner about what feels good and what doesn't, and don't be afraid to guide them during intimacy. Sometimes a simple, ooh, right there, or can you do that a little slower, or even physically guiding their hand to make sure it's placed in the right spot can make all the difference. And for those looking to expand their toolkit, I recommend considering using other aids like sex toys and vibrators to really just try new things and amp up the type of pleasure and experience that you can have. Remember, intimacy isn't just about fitting into one narrow definition of sex. Rather, it's about building connection and enjoyment and experiencing pleasure with your partner. Something else I like to look at are individual differences. I can't tell you how many times I've been in a session in which a couple is noticing that they're having difficulty in their sex life and one partner says, I don't understand what's wrong, I've never had difficulty pleasing a partner before, or every other woman I've been with has never complained, so I don't understand what I'm doing wrong now. Every body is unique and every woman has a different sexual experience and different ideas about what brings her pleasure. Some women have more restricted sociosexual orientation, meaning that they need more specific conditions to feel comfortable and satisfied sexually, while some women just experience pleasure and eroticism in different ways. So it's important to understand, again, what feels good for you and to be able to communicate that for your partner. And if you are somebody in relationship with a woman, I think it's important to check in with your woman partner and ask her what feels good for you or what would feel the most pleasurable. Another biological consideration is hormonal changes. Hormonal shifts, whether due to menstruation, pregnancy, or menopause, or other factors, can have a significant impact on sexual response and orgasm. For example, during pregnancy, increased blood flow to the pelvic area and hormonal shifts can heighten sensitivity and arousal for some people. On the flip side, menopause often brings decreased estrogen levels, which can lead to vaginal dryness and reduced sensitivity. Here's a tip. If hormonal changes are affecting your sexual experience, consider exploring ways to adapt. For example, using lubricant or vaginal moisturizers when experiencing menopause can make intimacy more comfortable and pleasurable. Additionally, engaging in activities that boost arousal like extended foreplay or focusing on erogenous zones besides just the genitals can make a big difference. For ongoing issues, consulting a healthcare provider or sex therapist can help to tailor solutions to your specific needs. Finally, let's talk about communication. When there's a lack of open dialogue about sexual preferences, needs, and desires, it's easy for misunderstandings or unmet expectations to creep in, leading to unsatisfying sexual experiences. Talking about sex openly can feel vulnerable, but it's often the key to unlocking deeper intimacy. My advice is to start small. Try introducing conversations about sex during neutral moments, not during or immediately after intimacy. Use I statements like, I'd really like to try this, or I really enjoy when you touch me like that. And try to express your desires without expressing blame or placing blame on the other person or adding pressure. Rather just noting, oh, I would like to try this, or this feels really good for me. Remember, communication is a two-way street, so be equally open to listening to your partner's feeling and preferences. For some couples, scheduling intentional time to talk about intimacy, free from distractions or free from being in the heat of the moment, can be a game changer for strengthening connection and increasing sexual satisfaction. So as you can see, the reasons for orgasmic difficulty in relationships are multifaceted. It's not about just fixing one thing, it's rather about understanding the whole picture. If this video resonates with you, know that you're not alone and that there's support out there, whether through therapy, education, or even just starting a conversation with your partner. Thank you so much for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more tips on sexual health and wellness. And as always, feel free to share this video with someone whom you think might benefit. Until next time, stay curious, stay connected, and remember, you deserve a happy, healthy, and pleasurable life.